Salam alaikum. Good afternoon. My name is Jean-Christian Lac from Medi, and I'm going to talk quickly and to show you quickly a short presentation. I'm going to shorten for sure due to the limited time about the new options in the treatment of lymphedema and how you can improve drastically your therapy outcome, and how we can manage to improve together the quality of life of your patients at the end. So just a few slides about Medi, generally speaking, well known in 5 different fields of business. The first one and the most famous one is phlebology with our compression stockings that you might know very well. But also famous in the field of hospital with anti-embolism, compression stockings too, in the field of orthopedics with soft supports and a lot of braces, in the foot care area with insoles and wound care. Just a few slides. I'm going through very quickly to show those different fields of business we're in. So, and now coming to the matter and the topic of this presentation, how Circade by Medi can improve the therapy outcome and the quality of life of the patients. So, the typical indications for compression therapy that we are daily confronted to, here we can see on the left side more the venous disease, and on the right side the lipedema or lymphedema. And the solutions on the left with the medical compression stockings, and the solution until now very spreaded all over the world, which are the bandages, standard bandages. Well, that's bringing me to one question: is that the only one solution? Is that always the best to do when you have to deal with lymphedema patients? What are the challenges for those bandages? The first one is how to measure the compression. Do I have the right compression? This is the first challenge. How to measure it, how to know that I'm applying the right compression. The second one is the time. How much time I need to apply the compression. Then is it really comfortable for your patients? How is it, how they feel with those bandages? Providing it's been done in the correct way. Is it really remaining at the same place, or is it getting loose? Is it sliding after a short period of time? Am I creating a kind of dependence on the doctors or on the nurses or on the therapists, the medical professionals in any case? Because very few patients, I would say, are able to perform the bandages on their own. And last but not least, the money factor. At the beginning it might appear like a cheap solution, but if I look at it on the long term, is it really that cheap? When I consider the number of bandages I need, when I consider the time of the medical professionals, when I consider that the patients have to move to the medical professionals every time to have a new bandage, is that really a cheap option at the end, considering all the costs related? And another thing is studies. With those bandages, it's been proved by a study that it's unfortunately very often poorly applied, and that actually less than 50% of medical professionals have been able to perform the right bandages with a compression that is useful. Means if I have a bandage without the right compression, it is useless, unfortunately. So now it's bringing me to the alternatives to those bandages and to the Circade story that I'm going to squeeze probably a little bit. But on the left side, this is Frank Shaw, who is the inventor of Circade, by the way. And how he came to this brilliant idea, it's because of his wife. On the right side, you see Herta Shaw. And she was a lymphedema, or still a lymphedema patient, stage 2. and she suffered a lot, and he could not stand seeing his wife suffering that much from the pain, from lymphedema, doing nothing. He was an inventor, and suddenly he had a brilliant idea. But I won't tell you everything, because otherwise I will tell you too much about the next slide. So, yeah, Circade by Medi, and this brilliant idea that he has is that it's like for the bandages, what you need at the end is inelastic material. It should be very inelastic, but adjustable at the same time. And this is what is not performed by those bandages. And, well, he looked at the giraffe, and he thought, well, the giraffe is standing 24 hours a day, 7 days a week, and doesn't have any problem with lymphedema, despite the fact that you have 250 millimeters of mercury at the ankle. And you've probably never seen a giraffe like this. So, this is because the giraffe skin is extremely inelastic. And the material of Circade has been, and the inventor of Circade that you've seen on the slide before, has been inspired by the giraffe skin. I'm not telling you that Circade is made of giraffe skin. So this is very inelastic. That is the key message. Here, probably due to the time, I'm going also to go quickly in this study. At the end, there was a comparison done, and this for a full period of 1 week. And you might have at the beginning, when the bandages are performed correctly, which, remember, is seldom the case, unfortunately. But you might have a higher compression at the beginning. But the problem is then that the bandages, those bandages are becoming loose, and then of course the compression is less and less. With the Circade system, as you can see here, you simply need to readjust. And this is very simple, the patients can do that on their own, and this is what those people were asked to do after a certain time. When they felt that it's becoming loose, they were allowed, of course, to readjust. And it's been proved that the pressure remained unchanged with the Circade, which was absolutely not the case with the bandages. So the Circade idea, it's of course this alternative to short stretch bandages, and also in some cases for also venous disease, an alternative to compression stockings. We will see that in the CAP classification later on another slide. It's a promotion of self-management, because while you have shown it once to your patients, they are able to take care of themselves. So you are promoting self-management, and you are involving the patients in the success of their therapy, which has also a positive psychological effect too. And also higher compression levels can be achieved and can be tolerated by the patients due to the inelastic materials. So it's very adjustable, and you can readjust it anytime, as you can see here. And one thing which is very important is the BPS. This is the BPS, and by using this card, you exactly know in which range you are, between 20 and 30, 30, 40, or 40, 50 millimeters of mercury. And it's very, very simple. You just need to put the black arrow on the black line of your Circade, and on the other side on the next black line, and you will exactly know if you are in the correct range, and you can make sure you apply the same compression. So it's a material which is very braceable and inelastic, so you can use it day and night. So you can keep on carrying the Circade at night. If you want to reduce a little bit the compression, it's very easy. You can simply readjust and lower the compression. Those are the options with the lower leg, the knee, the upper leg, the arm sleeves as well, foot options. So for the cases, you have Juxtalite. For phlebology cases, CEAP classification C2 up to C5. For an active ulcer, we recommend to use the Juxtacure for the C6 in the CEAP. And for lymphedema patients, stage 1 to 3, the JuxtaFit. And here you have premium essentials, you have foot options, you have the essentials for the arm as well, and you have also a lot of hand options as well. So this is the JuxtaLite that you can use for phlebology cases where the patients are not able to wear compression stockings, for example. If they can't bend themselves because they have severe back pains, this is the perfect product to be used. Circuit JuxtaLite. Yeah, here we can see also it allows patients to wear their normal footwear, providing there is no edema on the foot itself, of course. It doesn't inhibit the range of movement at the ankle, and it improves the calf muscle pump action. And you can measure, as we've seen with the BPS card, the compression anytime and readjust if necessary. So, promotes the self-care. For the CAP-C6, this is the JuxtaCure, which is also an alternative to the traditional bandages and which help to reduce the edema and at the same time heal the ulcer. So I'm squeezing the therapy concept where we have the decongestion and the reduction. I think the most important is safe here, showing quickly the JuxtaFit leg and JuxtaFit arm options. Here, the different sleeves. You always have with one circuit package 2 sleeves, so the patients can keep really on carrying the products 24 hours a day if they want, because you always have 2, so one can be washed, the undersleeve, and you can wash the circuit if necessary, but due to the use of the undersleeves, it's actually not very often required. Those are the different foot options, different hand options as well. So with circuit you can cover it completely. I don't know if we have, yeah, we still have maybe 1 minute to show quickly how it works here. First using the undersleeve. Actually you start down, but you can start up just to fix it, and then you go from the ankle to the knee, or to the upper leg. And that's where you measure exactly the range of compression you're applying. So, and it's easy to use and it's easy to remove, and the patients, when we say 24 hours, okay, if it's 23 at the end or 23 and a half, it's already much better than any other solution. So if the patients would like to take a shower, of course they remove it completely, they go take the shower and can adjust by themselves the circuit afterwards, which is not even at all imaginable by using the standard bandages. So just to make a summary, because I know there is a program and we have only very few minutes left, just to compare again, the AVCD on the left side, which is adjustable Velcro compression devices, like Circade. I will show it quickly on my own leg. Measurable compression anytime. Compared to inelastic bandaging, you don't know what is the pressure you're applying. Constant pressure. While using bandaging, even if you have a strong pressure at the beginning, it will definitely decrease. And you can only increase it by doing a completely new bandage. The mobility, it stays in place while the bandaging will be sliding down. You can still keep on wearing normal shoes, again, providing there is no edema on the foot, of course, on the foot area. The high concordance, and this is a very important point. bandages are making patients very unhappy and unsatisfied, while Circade is suddenly making your patients happy because they feel they can do something that help themselves, that help the therapy, the success of the therapy. So the more you involve your patients, the better it is. It has definitely a very nice psychological effect. And it's very easy to use. You don't need a very high training. You need to show it once, and then the people will use it. Therefore, you promote the self-management. While using bandages, you create the dependency on the nurses and the therapists or doctors in some cases as well. All right, I'm going to show it quickly on my own leg to show how easy it is to do on your own. Yeah, why not? So of course, I should put the undersleeve first. Oh, thank you. So I do it quickly because we have to save some time, so I do it without the undersleeves. And I start from the top, which is a mistake, I know, but it's just to fix it at the beginning. And then you go immediately down. And you always take 2 at the same time. You open 2, no more, because otherwise it's getting very challenging. Okay? And then you straight them here. And you try, when you're used to it, you apply almost the same pressure. But the first time, if you do not apply the same pressure, it doesn't matter, because then it's down. Thank you. Shukran habibi. So when it's down, you take the BPS card, the built-in pressure card, and you exactly know while putting again the arrow for you, you're a little bit far away, so you need to trust me. But if anybody still has time, he can come now when we are finished and try it by himself, or come later on to our partner, ITC, who has been successfully selling Medi, representing Medi for the last 3.5 decades in Egypt. So we are very proud to be associated with ITC, and you can come anytime to our booth to have your own demonstrations if you would like. So you simply put the black arrow on the black line and you measure your compression. And now I know I'm in the magenta area, which is the magic color for Medi. So it means that I am between 40 and 50 millimeters of mercury. It's as simple as that. Oh, it's finished. So those are a few cases with an ulcer, for example, which was healed using also the Circade juxtacured, a very nice result. Here this is a lymphedema patient, backside, front side, using also the Circade, having tremendous results after a very short period of time. The benefits for the patients: it's adjustable anytime, you have the constant compression, it's inelastic material, so they can tolerate higher pressure levels, they can wear it day and night, easy donning and doffing. It's a big improvement of hygiene because they can take a shower, and there is an increase of patients' independence or a promotion of the self-management. And the benefits for you, for the doctors and for the therapists, it's time saving, it's correct application within a very short period of time. It's improvement of patients' compliance with the compression therapy and the rest of the therapy as well, of course. Means exercise, nutrition, whatever belongs to the therapy of lymphedema. It's a very nice alternative to the bandages. It's a reliable therapy with higher therapy success. It's scientifically proven. And whatever the case here you have to face, stay cool because there is a solution. Thank you very much.